Sheila, you are now live.
I'm now live. Good morning, good afternoon, good evening, wherever you are. This is Professor Sheila Tlou, the co-chair of the Nursing Now Coalition and former Minister of Health of Botswana. So we're talking the Nightingale Challenge. Okay, this is a living example right here. So this afternoon, let me say we've had a great day listening to really inspiring stories of how the Nightingale Challenge is being implemented. And indeed, one of the sessions that I particularly liked was where we had intergenerational conversations between, the nursing leaders and their mentees. And it was a very great sharing experience. So this afternoon, we're moving on. It's also an opportunity to hear directly from organizations that are implementing the Nightingale Challenge. So we are going to have a keynote address from Elizabeth Madigan, who has just arrived. Welcome, Elizabeth, CEO of Sigma Nursing and Global Nurse Leader, who has championed nursing leadership and the Nightingale Challenge. We will also be able to hear about the experiences of the Nightingale Challenge from Brazil through Ana Julia Leme and Diana Bonfield, as well as from Ghana through Felix Ayante, Nursing and Midwifery Council of Ghana. So we have great experiences coming, and all I want to ask of you is to make sure that you take down your notes, you ask questions, you share comments. We have a share comment thing. So you are most welcome to put it in. The session is only an hour long, but we're hoping that we're definitely going to make most of it. So Elizabeth is joined by Caleb Phillips and Sarah Beth Silva, who have participated in Sigma's Nightingale Challenge, so that we are going to be hearing from them from the horse's mouth, so to speak. Over to you, Elizabeth. You are most welcome. Thank you very much.
Good morning. Thank you, Sheila. Good morning, good afternoon, good evening, wherever you are. We're delighted to be here. I am going to share my screen because I'm going to kick us off with some evidence and some information to help us get started. But I'm going to keep my remarks purposely brief so that you can hear from both Sarah Beth and Caleb, who are participants in Sigma's Nightingale Challenge. Can you see my screen? All right, let's do it this way, and then I'll do it this way.
All right.
Can you see my screen now?
Yes.
Okay, great.
You can see your screen.
Okay, great. So let me just give you really quick, just an overview of Sigma. So we are a 98-year-old organization. We were started by 6 student nurses in 1922. As of right now, we have 135,000 members in 540 chapters in more than 100 countries. We bring in people who are students, regardless of what educational program they're in, and we also bring in nurse leaders. And so some people aren't familiar with this, and I wanted to give you just a brief introduction about who we are. So we were delighted to be able to join the Nightingale Challenge. This has been a real benefit to us. We are very excited about our participants. We're expecting 20 applications. We opened our applications on a Friday. By Monday morning, we had 29 applications. And so we said, could we do 29? We said, sure, we could. We've also gotten subsequent applications since then. And so we're going to talk about a second cohort that we're starting. What happened, of course, is we started this and then we started with the COVID pandemic. So some of our participants have had to withdraw. But we've tried to do as much as we could to keep everyone engaged because we think it's really important. Some folks, even despite COVID, and Sarah Beth's a good example, have stayed with the program. So I want you to hear from them about how that's worked. Our overall view is we had important components here. One is about monthly webinars on leadership development. We've tried to make these that are very focused on young nurse leaders. And so they include things like your personal brand. So what does that mean? Where should you be on social media? How should you be portraying yourself as a young nurse leader? We've also done sort of what is leadership and why does it matter? What are the hard parts about leadership that you need to know? So we've really tried to make it very focused. And in my next slide, I'll give you the actual examples of that webinar. The other thing we did, because we're very committed to this, is we connected all our participants with a mentor. In previous sessions that I've heard here today, that mentorship piece is really important. And so we're very committed to that. And I'll tell you a little bit more about that. The other thing that we really wanted to do was we really wanted to have a day at the UN, and that was scheduled for May. Of course, that's been put on hold, but we're going to reschedule that because we want to give our Nightingale Challenge participants an opportunity to interact with our UN youth representatives. We have official status at the United Nations, and it's an opportunity for the participants to join that day at the UN that's led by our youth representatives. So you can see the topics that we've covered. The ones that are coming up yet are including bullying and incivility. We think that's an important strategy to know how to address. The other ones is why professional organizations are important. There'll be media training, and so we really anticipate a lot of dissemination by the end of this presentation. So we're very excited about this. The other piece is for us that mentoring is not something new to Sigma. We've been doing mentoring for a long time. For Sigma members, we have mentoring and coaching, and this also was discussed earlier in one of the presentations about the difference between mentoring and coaching. For us, mentoring is really longer term. It really is something that takes about a 6-month commitment. So that's why we hooked our Nightingale Challenge participants up with their mentor pretty early in the program. Each one had a different approach to what they wanted in terms of that mentoring and what they were looking for. So some wanted more career mentoring, others wanted more mentoring focused on what they were doing in their jobs and how they could be more effective. Our 29 participants were very wide-ranging in terms of their amount of nursing experience. Some had extensive nursing experience and some were relatively new nurses. And I think that's one of the benefits, is that they can share with each other as well. Certainly that's what we've seen. So I want to give you some evidence here. If you ever need to convince anyone about why you need leadership development, I'm going to give you some evidence here that you can use to make that case. So first is the State of the World's Nursing Report. As you know, that came out in April. And one of the key themes was leadership. And what they've identified is that we need nursing leadership and governance. It's critical to our strengthening. And in a quote, leadership programs should be in place or organized to nurture leadership development in young nurses. It doesn't get any much more stronger than that. So you can use that. The other thing I want to point out is what they found in the State of the World's Nursing Report is that 38% of nurses are age 35 and under in the world from the data they found, compared to 17% who are over 55. Now, this varies greatly, of course, by region, but there are many young nurses in the world, and we need to be doing a better job as every organization about providing the leadership development. I'm old, and so back in the day, the way you learn leadership was on the job. So you got put in a leadership position and you learned sort of the hard way in some ways. Now, there were ways that you could do some leadership development, but not like it is now. And so I would encourage you all to really seek out leadership development programs, because it's really how we're going to actually be able to move the needle. In addition, there was a report, and this has been referred to also in other sessions, that was funded by IntraHealth, Nursing Now, and Johnson & Johnson. This report is also freely available. Investing in the Power of Nurse Leadership, What Will It Take? This was actually a study where they had more than 2,500 nurses from more than 117 countries. So among the 3 top facilitators identified was leadership training, but also the importance of mentoring. And so what we need to do, and I think the report captured it beautifully, is we need to build nurses' self-confidence and sense of preparedness to assume leadership positions. We know that to become an effective leader, it takes experience. It's not enough just to read a book, but you need experience in it too. And then the third piece of evidence I'll give you are the triad meetings, which just completed last week. And so those include the International Council of Nurses, the International Confederation of Midwives, the World Health Organization, and other partner organizations. And I'm giving you quotes here so that you have those, but they really identify that there are too few national leadership positions in health held by nursing and midwives and women in general. And so the only way that we're actually going to be able to do this, the only way we're going to actually be able to impact global health is by investing in nursing leadership development. And the nursing leadership development we need the most investment in is in young nurses. As part of that, the WHO is working on the next version of the strategic directions for nursing and midwifery. So this is a policy document. This comes to the World Health Assembly, and the ministers of health and other influential governmental representatives are urged to implement these strategies. There's going to be a new development. Please keep an eye out for this, because there will be an opportunity for you to provide input. We need the input of the young nurses. We need your input. So please, we need your voices. So please keep an eye out for this and make a contribution. And then I'm going to finish up with letting you know that Sigma is looking for another group for the Nightingale Challenge. I have the link here if you want to sign up. We're currently taking applications, and I put my contact information there. So with that, I'll turn it over to Sarah Beth to talk about her experience.
Great.
Thank you, Beth.
Okay, so thank you, Dr. Madigan, for your words and your introduction to what Sigma has done for the Nightingale Challenge. I think it's really a testament to the caliber and quality of an organization that Sigma is, not only for the members, but its structure. And I know I'm personally very proud to be a member of Sigma. It's really a pleasure to get to be here today at this event to speak and represent not only on behalf of Sigma, but also my local chapter here in Toronto, Lambda Pi at large, and also to represent my organization, Mount Sinai Hospital, and of course to represent Canada. Can't forget Canada. So thank you so much for that opportunity. I thought I'd talk about how I had learned about the Nightingale Challenge. So one of the benefits of being the webmaster for my chapter at Sigma is you get information first before anyone else. So I had been told to post about this Nightingale Challenge. And when I read the description about what Sigma was doing around professional development, continuing education, career building, it really sounded like something that I wanted to be part of. So I said, why not submit an application? What's it going to hurt? And in the words of a very famous Canadian hockey player, you miss 100% of the shots that you don't take. So I went for it. I got support from my organization and my chapter president. And here we are. It's now 6 months into Sigma's Nightingale Challenge. And I couldn't be happier with the experience that I've had. It really has exceeded my expectations in many ways. And I'm going to tell you a few of those reasons. So the first item that I wanted to highlight was actually something that came out of our very first virtual session with Dr. Madigan about leadership. And there was one slide with one line in particular that really struck a chord with me, and it was, "We lead from where we are." When I saw this on my screen and heard it out loud, I finally understood what it meant, and it made me sort of have this awareness of, wow, no matter what role I'm in, what role anyone is in, whether they're in academia or clinical practice or research, whether they're at the bedside or in the boardroom, we all have the power and the ability to make a difference in the world and in this profession. And I think hearing this message right off the bat set the tone nicely for what the Nightingale Challenge is about. And I think it was really something that I was able to take in and bring to my own workplace. So in my own clinical role, I'm actually a clinical nurse specialist in a surgical oncology area. And I support nurses who are new graduates all the way up to nurses with 30 plus years of experience. And I too want to be able to foster this mentality with them so that they can also realize their own leadership potential. So I do want to thank Dr. Madigan and the Nightingale Challenge program for bringing this lesson right off the bat. The second component of what I wanted to share and highlight for me was the mentor component of the program. So as Dr. Madigan spoke of, Sigma had asked us to find a mentor, establish some learning goals, and take it from there. And their career center is a really well-run, well-oiled machine in terms of what they offer. They really allow you to identify and customize your search for mentors in their database. But I'll admit I actually had some struggles in finding a mentor right away. And then the pandemic happened, and unfortunately, I was having challenges in getting responses back from prospective mentors. So I reached out to the Career Center at Sigma. They were very supportive. They really actually listened to what I was looking for and were able to eventually find me a mentor. And boy, did they find me a mentor. What a fantastic person I've been able to work with. And I'm going to give her a big shout out. I hope she's listening, or maybe she'll listen to this later. Dr. Jennifer Embry is a fantastic mentor, and I'm so thrilled with the experience that I had in being matched with her. The great thing about our relationship is that we're both clinical nurse specialists. So we had that bond and that commonality right off the bat. And we were able to learn from one another. I think that's really key in a mentor and mentee relationship, that you can both learn from one another. We both had ample opportunity to speak. We've had a number of Zoom meetings together. I think we've really been able to grow together, and I think that's something that we can both take out of this. But there's really one key accomplishment that we can both be very proud of. So in one of our sessions that Dr. Embry and I had, I was telling her about some work going on in our organization relating to the pandemic, where we were looking to roll out some education for protected code blues. So for those of you that don't know what a protected code blue is, essentially it's changing the code blue response to a more thoughtful response mechanism, where rather than everybody rushing to the bedside to save the patient, you actually have to minimize the number of personnel in the room, don certain personal protective equipment. It's a very different approach, and it was a huge cultural change in our organization. So this required us to do some education through simulation. So I was talking to Dr. Embry about what we were doing, telling her about the simulations, how we had a really bad simulation, a really good one, how hard it was to plan and organize these simulations. And she stops me and says, "You need to publish this." And I was a bit taken aback by this suggestion, because I thought, well, how could I publish something? I'm not a doctoral prepared nurse. Who is going to want to hear from me? And she sort of reassured me that I have a story worth telling. There are people who are going to want to hear what I've been doing, especially in this current climate. And so she encouraged me and motivated me to where we are now. So a couple of months ago was when we had that first talk. And I'm proud to say that for both of us, myself, along with a few colleagues at my workplace, have submitted and co-written a manuscript for publication at the Journal of Continuing Education in Nursing, and we're just sort of pending the final stages towards publication. And I could not have done it without Dr. Embry, but I have to give credit where credit is due, both to the Nightingale Challenge and Sigma for bringing that connection together. I'm so pleased to have been able to do that with Dr. Embry. And I'm so pleased at what I've learned from this experience. It's now given me the impotence and the confidence that I need to be able to move forward and perhaps consider future publications. So I'm very thankful for that and the ongoing relationship that I have with Dr. Embry. So I just wanted to sort of give a final plug to any prospective future members of the Nightingale Challenge, and to employers who are looking to integrate this type of program in their workplace. I highly encourage you to do so. I think we do need to prioritize the leaders of tomorrow. And that's how I'm going to end it. Thank you.
Thank you. So Caleb?
Hi, it's great to be here this morning. And so whenever I was reflecting on my whole experience through the Nightingale Challenge, I've been really appreciative to have been a participant in this. I've been able to grow through exposure to new connections with individuals, through mentor matches and the other individuals in our cohort. But also I've been exposed to new ideas that have really helped enrich my ability to grow as an individual and as a nurse. And so when I was thinking about, what does my Nightingale experience really mean to me? There were about like 3 different words that I really felt like highlighted my whole experience. And so the first would be vision. So during our lecture on personal branding, the lecturer spoke to us about creating personal mission and vision statements. And I found this very helpful because it kind of gives you a very honed in and focused guide that you can kind of follow for yourself in order to keep going down your personal path of growth. Additionally, the mentor match has been extremely helpful for me, as it's been useful to build myself professionally and connecting with other organizations and individuals, but it's also helped giving me new ideas to research and things about that. The second word that I really thought about was positivity. So during this COVID crisis, it's been kind of hard to stay positive for some individuals. And the Nightingale Challenge and Sigma in general has been very flexible with us, like Elizabeth mentioned earlier, with replanning the UN, and also just my whole session with my mentor. We've been able to kind of work around things, change things around, and I think that flexibility has really helped us all stay positive during this time. Additionally, we had a lecture on appreciative inquiry, which at its core focuses on positivity. And I've never been exposed to that idea before in nursing school and all, and I was like, wow, this is really great, something that focuses on process improvement, but at its entire core focuses on positivity. So it was really helpful to be introduced to that, and it has changed the way that I approached managing change in the environment in general. And the last word that I'd like to mention is encouragement. So I'm a new graduate nurse. I graduated back in December in 2019. And because of the COVID pandemic, almost all the hospitals in my area have had a hiring freeze on new grad nurses. And so that's been very, very difficult for me, as I haven't had a super great transition into the field of nursing yet. But the Nightingale Challenge has really been able to help me stay connected within my profession. Through my mentors, through the lectures, I've still been able to grow professionally, and I'm really excited to grow clinically. Additionally, this experience has really helped me become an advocate for other new nurses, because it's not just me who's experiencing things like this, it's other nurses who may have had interruptions in their transition from nursing school to professional practice. And I think it allows me to advocate for how we can improve the whole process of kind of transitioning from nursing school to practice. And so this whole experience that I've had has been very, very enriching and very meaningful to me. And it's helped support me through kind of this difficult time in which COVID is an ever-changing issue in our world. And as we kind of think about how we're going to react to, the challenges that were presented in the future, by empowering new nurses, inspiring leadership, and just investing in new growth. And I think that this whole Nightingale Challenge initiative is useful, not just for myself, but just for nurses in general.
Great, great. Well, let's give them a virtual hand clap. This has been a very inspiring session, and I want to thank especially the mentees for sharing their experiences. But most important, I want to thank you, Elizabeth, for your commitment to the Nightingale Challenge and the work of Sigma really in advocating for our profession globally. It really does show that this is where we are now talking about the global experience. And I particularly liked that exposure at the United Nations. So let it go through very well, because, I always say to nurses, nursing matters in every sustainable development goal. We have a role to play there. From the first 5 that relate to human beings to the others that relate to development, but especially number 17, because after COVID-19, we will be really wanting to ensure that we build those partnerships. And that's where Sustainable Development Goal 17 is so important. So with that, I simply want to say this has been a great session, and it's well within your time. So I have a minute where I can quarrel with you, Liz, because at one point you said, I am old. And I thought, no, we don't say that. You say, like red wine, I have mellowed with age.
There you go.
And I am now refined and mature. Oh, wow. That sounds great. Okay. So thank you so much. But I'm sure there will be some questions that are coming on. My screen doesn't show who's asking questions. I'm seeing comments coming in, but that is great. So now we're going to the next presentation. Let me introduce you to Anna Lemme. From the Albert Einstein Hospital in Sao Paulo, Brazil. They were she is joined by Diana Bonfield, who is a primary healthcare specialist nurse of the Nightingale Challenge, still at the Albert Einstein Hospital. Now, they were the first early adopters of the Nightingale Challenge globally, and actually helped to launch the Nightingale Challenge. When we launched it last year in Singapore, they were right there. So Anna has led the development and implementation of the Nightingale Challenge at Albert Einstein, and we are delighted to have her share her experience in adapting the challenge, especially during this terrible time of COVID-19. So she shared her experiences of the Nightingale experience before, actually at a recent webinar. So if you can look her up, you will be able to listen to that webinar again. So, my questions to both of them, I don't know how they plan on doing this one, but I know I have questions and I want them answered very nicely. The first one is, tell me why the Albert Einstein Hospital decided to get involved in the Nightingale Challenge. What was the motivation for you as an employer? Secondly, how did you go about designing your program, and how did you recruit the early career midwives and nurses and midwives into the program? The third one, how has COVID-19 impacted on the program in terms of progress and really meeting your goals? I mean, we know we have extended the year of the nurse and midwife to July 2021. So we want you to know that we are right in there. Even if some of the plans could not be implemented, they will be implemented. But lastly, what are then your future plans for the Nightingale Challenge for developing more, people, and how can it be adapted to other places other than employers, just in Sao Paulo, but employers elsewhere. So this is, I think, the one where most people want to listen to hear. So go ahead. Thank you very much.
Thank you so much. It's a pleasure for us to be here with you today. Well, the challenge is related to our mission and our beliefs. We are a healthcare research and education institution. We have over 15,000 employees, which 70% are women, so that 32% are nursing staff, which 35% are registered nurses. So we identify a great opportunity to develop young professionals who are in the front line on leadership and soft skills, as it is not only training, but also the development of these professionals. It was an immediate acceptance. We have here an annual development and evaluation process that we called, that is our competency program. At this program, the goal is to identify and direct an integrated development way of these professionals through the construction of a set of competencies that guide the decisions in people management. So it was like a match that we could use the idea of the Nightingale Challenge on this. And the selection of the nurses was carried out in partnership with the RA board and nursing board, education board, and some reference professionals working in London on nursing leadership position. And during the process of screening the professionals, the first step consisted of listing all the nurses that work in the front line at age 35 or younger with good results in our competency program. At this time, we totalized 165 professionals. The leaders of these professionals were asked to recommend who had profile for the development process. After this stage, we got 61 professionals, and a board selected the 20 finally nurses. Diana is one of the nurses that were selected, and we kept the name of the others in a database for setting future classes. Our training and development program has 106 hours. It's focused on developing 3 key competencies in the group. The first one about systemic reasoning, the second one about interpersonal efficiency, and the third one, care and professional. We started select the nurses 1 year ago. As Sheila said, we are an early adopter of the challenge. They started the first part of the program in September 2019. and they finished it in November. The second part of the program should have been started in March of 2020, but after the outbreak, we have to change our plans. Here in Brazil, the first COVID-19 case was detected in February 2020, and our quarantine started in March. So we had to postpone our meeting and the program that was scheduled. Brazil is now the second country with more cases and deaths in the world. So we are still at a critical moment here in Brazil. Hopefully we are now at the top of the COVID-19 curve. For now, we are respecting this moment we have been through and the dedication and the hard work of the nurses to return with the program. According to specialists, June must be our worst COVID-19 scenario in Brazil so far. We still have 147 hours of training left, so we are postponing this to August. We used it to do 2 present meetings per month, and now we are planning to change it into virtual meetings to keep everybody safe. Our nursing college has changed the classes into virtual classes. So we would like to keep this good experience in our development program.
Oh, okay. Thank you very much. So, who's coming in again?
Anna, are you still there? How about it'd be nice to hear from Diana about your experience in the Nightingale Challenge.
Yes.
Hi, I'd like to say thank you everyone to this opportunity to share our experience in Brazil. It has been a while since I have spoken English. If you don't understand something, please ask me to repeat, and I'm say sorry. And my experience in Nightingale Challenge is very amazing. I think this opportunity is unique because I can develop and improve my skills as a leader and starting to apply it during my routine work. I could meet new nurses and leaders inside and outside our institution. I could discuss and propose new projects inside the institution. I could discuss about nurses' competencies and how we could improve it in primary healthcare as a project that you're working as implementation, a nurse practitioner in primary healthcare in Brazil. So during the COVID-19, the scenario became so challenging, and I think the Nightingale Challenge class that we had was something that helped me. And I'd like to sit to us to tell you one example that is about a specific class that is for technological revolution. And so during the planning actions to COVID-19, I have to think many times outside the box. And information's moving fast, and I'm as a nurse, I have to help my team to structure new ways to work with difficult scenarios. And the class and the experience and the nurses who I met in my classes in Nightingale Challenge helped me a lot in this episode. As a result, we as a team have been implementing the telemedicine in 87 primary healthcare teams in São Paulo and creating the new way to access primary healthcare. What I think is a very nice experience too in primary healthcare is that can keep it close to the good mentorings, the good nurses that are excellent nurses and a good reference to the leaders inside the institution and outside. And I can cite one that is my boss, that is Luciana Borges, and she's a nurse who helped me to do the best I can, and she helped me to look around and to do the best you can do for the best health system for all, a health system with more equity and a universal cover. So I think, and I'd like to say thank you for the Nightingale Challenge, because they help us to know and to develop the power of nurses have, and where we can put this in the routine and transforming now our practicing and take better that we can our patients.
Thank you very much. Thank you very much, Anna and Diana. We have heard from the early adopters, and had it not been for COVID-19, they would be very far by now. But they are right there. Their stories are very inspirational. And I think I like that thing when you are saying thinking outside of the box and really having to work with different scenarios at the same time, because that's exactly what leadership is all about. There is no set way. You have to think outside of the box. And if you can't, then you simply throw away the box and do what you think is the best you can do. So it's really great. So for me, my only regret is that I missed, because of COVID-19, I was going to be coming to Sao Paulo, but now I can't go. But we're hoping that maybe next year we will be able to meet again and I can be able to see what you all are doing. Yeah. So thank you so much. Now I'm turning over to my own continent, the Africa that we love. I'm going to introduce to you Felix Nyante from the Nursing and Midwifery Council of Ghana. And it's the one country that I was able to visit. And I know some of the mentees that he has in there are people that I actually met when I was there in Ghana, because it was a meeting of nursing and midwifery leaders from the whole of the country. And I had a good time. I can come back again anytime. So anyway, Felix, we are with you. We want you to tell us about the Nightingale Challenge in Ghana, especially how you were able to bring, about together so many partners. How also can we drive our efforts in education programs to equip nurses and midwives to drive progress in primary health care and universal health coverage? And lastly, what advice you do give to organizations and health employers who are considering accepting the Nightingale Challenge? I particularly want to, and the last one, in encouraging countries to join in, but also to include Western Central Africa, because you know what, is Ghana and Nigeria so far. And we are missing quite a number of countries in Africa. So maybe when it comes from a fellow West African's voice, it will gel in. So over to you.
Thank you, Sheila, and good morning, good afternoon, good evening to everybody out there, wherever it may be, depending on the time. We in Ghana are so excited to be on this platform. And like Sheila ended, why is it only Nigeria and Ghana? It's just because Ghana is the gateway to Africa. So we are going to be like a hub to reach out to other African nations. That is on the lighter side. But straight to business, Sheila and distinguished ladies and gentlemen, we in Ghana have realized that we are well positioned to collaborate and partner with other institutions to roll out this Nightingale Challenge. So we have partnered with about 7 institutions, and what we did was, as a regulatory body, we used our regulatory mechanisms to write to these hospitals. Some of them are teaching hospitals, some of them are regional hospitals, and the only quaternary hospital in Ghana to nominate for us, depending on the criteria that Nursing Now campaign gave. And so these institutions gave us either 3 to 5 participants. And it is amazing that Ghana has to report that instead of 20 participants that was earmarked, we had a total of 67. And because we want to unleash the potential in them, I have selected just about 8 to be with me in this video conferencing room. And out of the 8, 4 will share their experiences with us 1 minute each, and their diverse experiences. And so without much ado, I want to invite from the various disciplines, nursing, that's general nursing, midwifery, mental health, and public health nursing. I want to first and foremost invite Philemon. Philemon is right here with us to share his experience with us on the journey that we have started. Philemon, the podium is yours. 1 minute.
Okay, thank you, Mr. Registrar, and good afternoon to you all, wherever you find yourself. My experience with the Nightingale Challenge has helped me gain leadership and management experience, in that we have been taught several activities as part of the seminar that we have had in areas of memo writing, financial report, and budgeting. Again, we have also learned how to mentor others, and we are looking forward that after this whole seminar, we will go back and impart the knowledge gained onto our various colleagues in the facility level. Then again, we have also realized that as a leader, you must show positivity. In this corona pandemic, we have been able to earmark and go on with whatever activity that was planned earlier, regardless of the corona pandemic. So thank you so much for the time.
Thank you, Philemon. And so Sheila, we started answering your questions in terms of the impact of the COVID-19 pandemic on our activities. What here Philemon says is that we are resting our performance on ICT to accelerate it. And so corona pandemic or no corona pandemic, we are embarking on the Nightingale Challenge here in Ghana. At this point in time, I will want to invite my second mentee, Chris. James will share his experience to the international world.
Right, good afternoon. My name is James McKeon from the Hospital, Department of Medicine. Throughout the discussion we had in the week of the seminars, one thing that came out was the fact that nurses form a majority of all healthcare providers. You go to rural areas in our cities, nurses are there. Even in this COVID era, nurses are at the forefront providing care to people. But when it comes to decision making and initiative, nurses are usually not part of those making decisions. So in our seminar, we learned how to reposition nursing for nurses to take a rightful place through advocacy, through training, so that going forward, nurses, older ones, and those coming will be those who will be seen in our ministries, in our offices, taking decisions that will help us to move nursing forward. So we are so glad to be part of this program, and we know that going forward, a lot of things will come out of it. Thank you very much.
Yes, James. That was news in brief from James. Now I have the honor of inviting Chris. Chris, tell us what you have learned so far and what is in store for us.
Good afternoon. My name is Chris from the University of Ghana Medical Center, the only quaternary hospital in Ghana. I am very privileged to be part of this challenge, and together with my other participants, we are very, very happy to be part. Not only did it give us the opportunity to meet other nurses or to interact with other nurses, but we also have the chance to be mentored by great leaders in Ghana. And also, we are thrilled that we have the opportunity to be trained. We have a series of training, and we are thrilled to know that use of social media really affects our profession. And then the way we portray ourselves on the social media should have positive impact on nursing. And we look forward to having a refresher course in basic life support. Thank you.
Yes, so that was from Chris, and we have Christian. We have Chris and Christian. So Christian, you will also come and share your thoughts with us.
Yeah, Felix.
Hello.
Felix.
Yes?
Yeah, let's have just two more because of the time factor. Yes.
Sure. So this is the last
Yeah.
participant, then I'll come in and wrap up.
All right.
Okay.
Christian.
Yeah. Through the Nightingale Challenge webinars, we have been exposed to implementation research, which is different from academic research. So we are a four-member team in the council. We are currently using an iterative process of looking at our operational challenges and coming out with practical solutions which will enable us solve these challenges. Thank you.
Thank you very much.
So thank you. So the methodology we are using in Ghana here in this presentation is I had to open and then my mentees will come in 1 minute each, then I'll wrap up. So in wrapping up, Sheila, what Ghana has to showcase to the international world is that in terms of collaboration and partnership, we at the Nursing and Midwifery Council have tried as much as possible to partner about 7 organizations, and that has given birth to these 67 mentees. And it's amazing that we have consent from their CEOs and their nursing and midwifery directors and nurse managers at the facility level. We have also embarked on research, and we have outsourced the whole supervision to our colleagues at the university. We have 10 supervisors who are actually supervising these 67 mentees, and they are led by one professor in the University of Ghana, Legon. They have 5 months to do this implementation research and to submit their report by November this year. Sheila and distinguished ladies and gentlemen, we have other interesting programs under our sleeves, like basic life support webinar, and then webinars on data management and in nursing and midwifery practice. We also have other activities where we'll actually embark on tours to the length and breadth of the country to showcase where we have vulnerable communities and how nurse leaders and midwife leaders can actually unleash their potentials to address issues that relate to primary health care. So distinguished ladies and gentlemen, when you talk of the Nightingale Challenge in Ghana, all we are saying is that instead of 20 participants, we have opened our arms and we have received 67 participants. We are embarking on a myriad of activities, and by November this year, we shall have the report on the implementation research ready, and we will share it with the international community. Thank you very much, Sheila. Thank you.
Thank you very much. Thank you very much, Felix. Now, this brings us to the end. Just at the time is not with us, but let's give the presenters a hand, a virtual hand. And for me, all right, that virtual hand. I'm sure people are as inspired as I have been. Here we are. Actually, when the Nightingale Challenge was launched in Singapore last year, we had thought by this time we'll be having 20,000 nurses. But it turned out that now we have 28,000, almost 29,000. So now, since we have actually extended the year of the nurse and the midwife celebrations, we are expecting more and more because, look, we have to cover a lot. And indeed, Felix, for me, is really also a message to the colleagues in Western and Central Africa to say, jump on the bandwagon before it's too late, because we don't want to leave you behind. So let me thank everybody, Liz, Anna, and the colleagues, and indeed the mentees. We have heard it from the horse's mouth. And to me, one of the questions I was going to ask you was, what was the highlight, in your training or in your mentoring? But we don't have time, but you can share your experience those are always very beneficial to the others who are either being coached or mentored or educated. So with that, thank you very much. Let's give ourselves another virtual hand. Yes.